Welcome to the third edition of the Femina x Grazia Virtual Beauty Carnival. I'm Hitanshi Kamdar from Grazia, and we have a very special guest on our platform today. I'm very excited to introduce Dr. Jamuna Pai, celebrity skin expert and founder of Skinlab. Thank you so much for joining us today.
Thank you, Hitanshi, for having me here.
Okay. So the reason we're here today is because through the last year, of course, COVID has affected our physical and mental health, yes, but it has also affected our skin and our hair. In fact, a lot of people have been reporting skin rashes and hair fall post recovering from COVID. So to start with, can we start with how COVID has affected our skin and health?
Yeah. So hi, everybody, and I'm very happy to be here today. Thank you for inviting me, Hitanshi, and the Grazia group. COVID, as we know, I mean, everybody knows about COVID, so you really don't have to be even educated to know about COVID. But what it has done a lot of damage internally and to people and their families. But when it comes to me, it is all about skin care and hair care. So what do people complain of? What has COVID done to their skin? Now, skin, as we know, why all these changes have occurred, let us put in a nutshell, is that when there is a viral or a bacterial, infection that affects the body or any kind of infection, there is a reaction of the body. It is an action and a reaction of the body, and the body reacts in a particular way. If the immunity is a little lower or the virus is strong enough, stronger than our immunity, then we contract the condition. And then, of course, all the symptoms and signs that go with it. Now, this has been quite debilitating, and it has caused, let's say, a lot of woes. And but when it comes to hair care and skin care, on the skin, you see a dullness of the skin. You see patchiness that was never there. You see more dryness in skin that was already dry, or normal skin getting dry. You see, people are wearing masks, and suddenly skin that never had acne is suddenly, coming up with acne. They pull down the mask now when the clinics have opened, and they show the acne, or they show anything that has worsened behind the mask because of the temperature conditions and the lack of air circulation, etc. So these are the skin woes. And where hair is concerned, it is shocking to see that the people who have gone through the COVID infection and gone through their 14 days quarantine, etc., and post that, besides their weight loss and them looking, of course, weight loss also causes a shrinkage in the skin, Hitanshi, as you know. Suddenly people who deflate, the skin becomes loose. But besides that, so it obviously loses its shine, but the appetite also is reduced. And so there's no appetite, there's no keenness of having proper food and on time, and you're mentally low. So all kinds of deficiencies show, and our skin is always a mirror of what we are inside. So all the deficiencies, which leads to oxidative damage, in the body, which reflects on the skin. I'll explain about oxidative damage a little later. We're talking about the acid-alkaline balance, and so all this. And in the hair, like I told you, when it comes to hair, people have come with packets of hair saying this is how much we shed hair every day. They feel that they're going to lose all their hair, but actually what is happening is, in the hair, hair life is, there are three phases. There is anagen, there is catagen, and there's telogen. Telogen is the shedding phase. Now, when the body is in shock or in disease, the telogen phase becomes longer. And so that is the shedding phase. So you have a lot of hair shedding happening, a lot of hair. And people are wondering if they'll ever get the hair back. The good news, Hitanshi, is that it is reversible, and over a period of time, when their nutrition improves, they start taking supplements, when their exercise rushes blood to the skin, etc. When all this reverses, they'll see that their hair also increase, protein intake, everything will help.
Okay. Okay, so that I think covers about how we can combat the tremendous hair fall that people have been reporting. Another issue that's been, like you mentioned, is dull and tired skin. So how do we take care of that?
So it has become dull and tired because of, because of the disease itself. Okay, because of lack of appetite. So nutritional supplements are not there internally. A lack of exercise because you feel actually the disease itself is debilitating. So you're resting. So you're sedentary. So there is lack of exercise. Now we know that exercise, good food, and all exercise especially rushes blood to the skin, and skin does, I mean, what it normally does, fresh blood, it supplies oxygen, it supplies nourishment, and it takes away the toxin. Three simple things. Now when there is no blood rushing to the skin, I mean, there is no exercise, so there's no pumping blood into the this thing, plus anything that comes to the skin is so poorly poor in nourishment. Antioxidants are lacking, protein is lacking, there's no balanced diet there. Is there any diet at all? Because there's so much of lack of appetite. Okay. So how are we going about taking care of this during that time, and mostly post the quarantine time, or even for people who are taking care otherwise, is going for anti-inflammatory foods. Now, when you see inflammation, I'd said in the earlier that what is oxidative damage and inflammation. I will just explain. Is that all right if I explain? Yeah, because that's
Yeah.
important. So whenever there is, like I said, any invasion by a virus or any infection, there is inflammation in the body, and this inflammation, it's a cycle. If the medium inside, that means you're taking too much sugar, is wrong, you're not exercising, you're not sleeping enough, and your lifestyle is wrong, your diet is deficient, you have natural deficiencies, and you have deficiencies of other vitamins and all, the internal tissue becomes acidic. Acidic means it is a pH of 1 to 7. Okay, now in this acidic medium, that means your lifestyle is not good, you are inviting problems. That means right from a common cold, God forbid, to cancer, is all when you test, because you say healing with food, even in cancer, it is that you are changing this acidic medium into an alkaline, to be very simple. How are we going to do that? Now, alkaline, how are we going to make it just alkaline, which is the healthiest, which kind of prevents us from getting the disease? So, how do we make it alkaline? Make sure that our nutrition is balanced. Okay, have nutritional supplements that will help you. Supplements that are antioxidants. This is what it does. It changes antioxidant. It changes the medium from acidic to alkaline, and reverses the oxidative damage. That is the damage that has caused. Yeah. So vitamins like A, C, E, curcumin in natural form, ginger. If you're looking at natural sources, then deeply colored vegetables and fruit, a nice, green vegetable juice, which is rich in chlorophyll, will also help in changing. I'm talking about all the natural things. Then changing your lifestyle a little bit, cutting down on sugar, cutting down on alcohol. Like I said, resveratrol is okay, but otherwise, then drinking enough water, slow exercise, even if you're tired, even if it is post-COVID and you're feeling a little tired, a little walking within the house, that is sufficient, that you think. And start exercising in baby steps, and you will see the blood rushing back, your appetite coming back, and the whole reversal taking place, So that is fighting oxidative stress with diet and with natural supplements. And what else are we going to do to get back the shine in our skin? So we would be using alpha hydroxy acids, like glycolic acids and all that on the skin, vitamin C, niacinamide, all these things as general. Even if you're at home and you have these products at home, do it. Use home, from the kitchen shelf. You can use paste made with milk powder, which contains lactic acid, which is both skin brightening as well as it moisturizes the dry skin. So that is of great help, but not only by itself. If you have an oily skin and prone to acne, you can mix a little bit of multani mitti or fuller's earth with it to make a paste, to give it as a base. The milk powder is anyway a paste. You can, if it is oily skin, you can add lime juice because that helps. It has citric acid, which will help cleanse the oils. And if to the two, you may add glycerine, which helps in adding more moisture. So this way you can make a paste and apply it on the face and leave it for 20 minutes. Wash it off in circular, gentle motions. This will also take away the dead skin cells that have built on and prevented light from reflecting. You know, healthy skin and healthy hair has to reflect light, you know, then it is healthy. When we see porous hair, we know it's not shiny. When you say not shiny, that means it is not reflecting light.
Yeah.
So for the same way, the dead skin cells are also taken out, starts reflecting light. Using of, you know, an emollient. Emollient means it contains products like urea and lactic acid, and it forms a barrier and prevents the loss of water from the skin, evaporation of the water from the skin. So you can use these barrier shields and keep your face always well moisturized. Make sure that during the day there is sunscreen, even though you're at home. Why? Because despite us being in maybe in a cloudy area or maybe, you know, in a closed room, we are now all become gadget junkies, in the sense we are using our phone more. We are watching Netflix. We are working from home. So we are obviously using our laptops. So there is screen time has increased so much, and the blue light that is emitted from these gadgets is also quite harmful to the skin. So using the sunscreen, like before, once in the morning and once after lunch, about 4 hours gap, and as thick a coat as possible is what is going to help in the long run. And I say that I love coconut oil. I have, you know, talked about coconut oil for the longest time, more than 2 decades, but now it's a fad. Now it has become so important, coconut oil, whether to ingest, whether to apply. So that also, coconut oil and dry skin. I say dry skin's best friend is coconut oil. So just apply a nice, generous layer of coconut oil and just wash off very mildly and pat dry. And then you are you're reversing the dryness and you're delaying the aging process, because dry skin always ages the skin faster. Okay. And the last but not the least, the night care can be something that contains, after, you know, seeking your physician's guidance, something that contains an active like retinol. It's my favorite active ingredient. And anything that contains a hyaluronic acid gel. So you apply your retinol base, which will repair, which disperses pigmentation. It repairs the collagen. It removes the scars if there are superficial acne scars. So it does a whole lot of magical things. So apply a very thin or sparingly apply this, and use a hydrating or a moisturizer, depending on your skin type, a hydrating, kind of a cream or a moisturizer. And this is your day and night routine.
That's fantastic. Now that restrictions are easing and, skin clinics are slowly opening up, are there any treatments you would recommend we should sign up for to deal with the post-COVID skin and hair effects?
Right. So the thing that I love the most is, one of the best things, my favorite, is exfoliation. Because what happens is that when there is a layer of dead skin cells, which builds up, maybe because you have not gone out in a year and something, or not done anything to your skin because you feel there's no need. Many people say, that there is a mask now, there's no need to do anything. But in short, you are letting the dead skin cells pile up. There is, of course, a natural shedding that is happening, but it is not fast enough. That has also slowed down. And so When I said that the skin, healthy skin reflects light, that means it shines in all the areas that you want. If there is dead skin layers, imagine, usually there are 5 to 10 layers of dead skin cells. But if you remove this, can you imagine a flat, plain skin reflecting light, you know? And that is healthy skin or shiny skin or skin that everybody would like to possess. So how do we exfoliate? Like I said, at home, the homemade masks, I gave you the examples for oily skin and for dry skin. But at the clinics, you can sign in for soft gel peels. They use for alpha hydroxy acids, like glycolic acids and all. They use for normal skin to dry skin, and salicylic acid, the beta hydroxy acid for. So you can sign up for a series of these peels, which will help in exfoliation, which will help in healing of the acne, removing excessive oils, hydrating, etc. Then lasers also, for whatever reason that you're seeking lasers, for maybe brightening of your skin, maybe for hair reduction, maybe for any number of things, you know, light therapy, you can use laser. You can start now that it is a little safe. We had stopped it in between the whole time that there was a lockdown, is the micro needling. Even at a young age, if people have mild scars or little pitted scars, or for anti-aging, if you know, you want to reverse the aging process, I just told you it is thinning of the skin because of the collagen thinning and the collagen bands slackening. So if you want to improve that, anything like light, heat, injury to the skin always makes the body react to this, to these things, and they send fresh collagen or baby cells to as a mode of repair. Okay, the skin recognizes that this part is heated, this part is, you know, micro needled. So when there's needling happening, there are new cells, there's neocollagenesis. This builds the collagen again, makes it healthy, and so there is tightening or there is scar revision. So you can sign for a whole lot of these. Then there is the growth factor concentrate, popularly known as the platelet rich plasma, PRP, which is done for the skin. Again, this we have recently opened up at our clinics, which is done for the skin, for, of course, for rejuvenation, and for the scalp here also, because it stops the hair fall completely after 3 sessions at 1 month interval. That's what we have noticed. It improves the condition of the hair, reduces the frizziness. So it is all in all a win-win situation.
Okay, that's great. Again, now to add to the woes, the monsoon's here and there's a whole new set of skin challenges with it. So is there a very easy, fuss-free daily routine that we can follow to avoid clogged pores or breakouts?
So with the monsoon coming, monsoon in already, you know, the humidity levels are very high. So we would like to keep our routine very simple. So keeping the skin clean, and like I said, reducing the dead skin cells is very, very important. And so just using, cleansing the skin, like I said, the layer of dead skins, trying to remove, because otherwise they seep in with the increased humidity, with the sweat that may be there, because gyms have begun to open, people are exercising, you know, using the time for improving their health. And you see a lot of people looking fitter, but during the process, these cells, if they're not cleaned, can clog the pores. And so cleansing of this thing is very important. And then applying your sunscreen at least twice in the day, like I said, at all times. This the UV rays definitely go through the ozone this thing layers and comes through the clouds. So we think that when it is raining or when it is snowing, we need not wear sunscreen, which is a myth. So use of the sunscreen can also help. So, and at night, keeping it as simple as possible, using you know, a good cleansing depending on your skin type, cleansing your skin. If you have used makeup, of course, do it twice over, using your repair cream, whatever. If it is oily skin, the repair cream is different. If it is an aging, you know, the active ingredient, keeping it to its minimalistic, and applying a thin coat of moisturizer. I think that would be a simple a routine that you can follow in the thing. But always check with your physician before you use any active ingredients. Okay.
So skincare has become synonymous to self-care, especially through the last year, because this was this one time that people spent on themselves. Do you think that that messaging is led to more people prioritizing skincare over makeup or something like that?
Yeah. So actually, it's we are almost finishing 3 decades in the skincare industry, and maybe I can take a little bit of credit for introducing skincare as a very important facet of our lives. Skin is the biggest organ of our body and requires care, And in the last decade, people have started paying even more attention. They've come with bags of products and shown and said, how do we take care? And this is bothering me. I want to go out. Everybody's wish is that they want to go out with minimal makeup and the skin shining, completely reflecting light. So that is what their wish is. It's on their wish list. So looking after their skin. So they've started taking, because the skin reflects what you are outside, of course, because it is telling its own story, but it's also telling a story of what is inside, how you're eating, how you are, how much exercising, because I can easily tell when a client walks in. Besides the fitness level of the client, I can always tell when whether the client is exercising, regularly, not exercising. They say, yes, I've joined the gym only. I said, how many days? Because I can make out from the skin. How do I make out from the skin? Because I said exercise always pushes blood to the skin. Otherwise, from the heart, from the aorta, or the main supply from the heart of fresh blood, by the time it reaches skin, the end organ, it's hair-like capillaries supplying the skin with fresh blood. So if the bigger arteries can get clogged or blocked during a lifetime, you can imagine how quickly these hair-like capillaries, get blocked. So there's hardly any blood if we have a sedentary life. If my life is at the desk, I won't have blood rushing to my skin at all. That's the end organ. So I need pressure. So what is the pressure? My pressure is that I'm exercising, I'm doing, some kind of aerobics, I'm doing Zumba, I'm just giving you examples which I tell my clients. If you don't want to join a class, your teacher can't come home, you don't want to allow him, just go on your, your tabs or your this thing, go on YouTube and you'll get a variety of whether you want to dance like Madhuri Dixit or whether you want to, kind of do Zumba, and all of this will rush blood to your skin, which gives it nourishment, oxygen, fresh oxygen, and takes away all the toxins from the body. So that the sign of healthy skin is when it reflects light, like I'm saying again and again. So with the minimal of makeup or no makeup at all, that's everybody's wish list. Okay. Correct. And taking nutritional supplements, drinking enough water, sleeping, having good mental health. I think all this will put together and give that inside beauty which gets reflected. And if there is a genetic problem, genetically you have inherited some kind of a problem on the skin. Maybe there is a hormonal imbalance which is commonly there during the teens, and we see a lot of it. So that could bring about problems. But if you keep, even your medicines will act better if you keep a good lifestyle and exercise well. So I think, and nutritional supplements, make sure your diet is, kind of has the proper macro and micronutrients. There are so many experts that can help you with this. So I think taking care of your skin has become very important to all of us today.
Correct. Okay, so wrapping this up, are there any skincare trends that you see gaining traction in a post-pandemic world?
So there are two. One is the skin detox, that people realize that just like we did a wardrobe detox, we did a shoe detox, like everything, we said we can do with absolutely minimal this thing. Why do we need so many clothes, or do we need so much this thing, makeup or in any form? We realized that we were doing too much, or we had too much of everything. And so even with skincare, it is skin minimalism, And the second part is skin detox. That means you already for so many years, say people of my age, people otherwise younger who are 40, or people who have started early with makeup. Can you imagine with all the layers of makeup? Or they are thinking they are using so many layers of skincare product, which is not necessary at all. So during this time was the time that they said, we are not going out, we are covered with the mask. This is the best time to see if just using the minimalistic of products. So what would they be? There would be a cleansing product that you would cleanse away and this thing. Then just applying a tiny bit of a moisturizer depending on your skin type, or a sunscreen with a built-in moisturizer. That's all that you need. Repeat the sunscreen 4 hours later. That's all. Keep your skin clean. It may be twice, it may be thrice that you need to wash your skin. Okay, depending on how much you feel not clean about it. And at night, again, keep washing it off. If you've used a light coat of makeup just to feel good, wash that off. If you've used makeup, maybe wash twice. Use your active ingredient, just one ingredient, just one coat of that. And because you may be sleeping in an air-conditioned environment, you don't want the product to dry it off or the skin to dry. You're using a thin coat of a moisturizer or a night cream. That's it, like these 2 steps in the morning, 2 steps in the night, and there you go. Keeping a healthy lifestyle. You're not exposed to any pollutants except the screen pollutant, and otherwise, yeah. And then last but not the least is that there is something called ingestible beauty, which is a new trend, that is trending now. What is ingestible beauty? Is that people are taking a lot of supplements. Hitanshi, I'm sure you have also noticed, at least in Bombay, we are seeing big stores that have changed into wellness and nutritional centers, like selling all health foods and nutritional supplements. So, stores that were there like for 100 years and all that have gone into, because in the last 1.5 years, it has all been about nutritional supplements. And so ingestible beauty, one is the collagen powder or the collagen liquid that people are taking. As the skin is aging, I told you, it loses collagen. The banding of the collagen gets lax. And so you see the falling down of the skin or going south, and that shows us the signs of aging. So they give elasticity and firmness, the collagen supplements. They promote the synthesis of collagen again. So they improve the skin texture. They also improve bone health, which is, of course, collagen supports bone health, which we know. Okay. The other thing that ingestible, like you said, you feel a little bit, you want to have a drink. Best to go for red wine, and then there is resveratrol, which is a powerful antioxidant. So that, like I said, what does an antioxidant do? It supplies the body with good nutrients. It takes away the toxins. It makes our tissue alkaline. It is good for the heart. Okay. Then hydration of the skin. Okay. So hydration of the skin, we are using products like sodium hyaluronate. You're using alpha lipoic acid. All these are nutritional supplements. Like I said, antioxidants in the form of vitamin A, C, E, L-glutathione, the new baby antioxidant on the block. Everybody wants to take it because it is good for the skin. It brightens the skin. People want the shine in the skin, and also all these, the antioxidants, we know that increases immunity. So obviously, I told you the alkaline part of it, it increases the immunity also. We all want to increase our immunity. We don't want COVID, whether it's the first wave, second wave, third wave, or a second attack. No. So increase our immunity by doing all the things that are right for you. Skin, keep it to the minimal, this thing. Have your nutritional supplements properly. Make sure that you feel fit and strong all the time. The cosmetic parts of it, like looking after your hair, looking after your skin, that the nutritional supplements from within are going to help both, but keeping the skin and the hair clean will also go a long way. Green tea extract, L-carnitine, and another thing that is spoken about a lot in the media and when we see them on the phone is Garcinia cambogia. Now that I'm speaking about health and health supplements, a lot of people have come and asked me because they've seen ads that it can take away your weight or dissolve fat. What how it works is it reduces your appetite and thereby increasing the metabolism too, and so it helps in reducing. So also green tea extract in combination L-carnitine with this. But then it is best to seek your physician's advice on whether you want to take these or no. But these products have always to be complemented with a proper regime of exercise and diet plan, otherwise they don't work.
Of course. Thank you so much. It's been a very insightful session, and I think we've learned a lot about how our skin reflects our health internally as well. And you've given a lot of really, I mean, they're very easy to follow tips, and I think skin minimalism is something that's really picking up.
Yes.
So thank you so much.
Thank you, Hitanshi, once again, and the team for supporting with the sound and technology. Thank you so much.